I want to hand it over to Jill. Jill is co-chair of the parent working group and of her local patient parent. I don't know what PPAT stands for.
Parent-patient advisory team.
Jill's fantastic and wonderful, and the rest of the time, except for like 30 or 45 seconds at the end, is hers. Jill, take it away.
Okay, well, good evening, everybody, and thank you so much for joining us here this evening. Wanted to do a special shout out. I know a lot of folks are coming from school or home or work or what have you, but it really means a lot to us to have you part of this community and be members of this community virtually this evening. So I did want to thank you all for that. Welcome to the party, and we're glad that you joined us. So we did want to acknowledge Dr. Coletti in his transitioning out of ICN as of June of 2020. We really, as the parent working group, wanted to thank Dr. Coletti for his unyielding commitment to improving the care of children and adolescents with inflammatory bowel disease. We did want to mention that parents will have a voice in the selection of our next two leaders. We'll actually have two individuals taking over for Dr. Coletti. And we wanted to emphasize that we need the parent voice to be active participant stakeholders in this process, and there will be mechanisms for that to happen. But we wanted to sincerely thank Dr. Coletti and wish him well in his next chapter. Next slide, please. And then we wanted to take a moment to congratulate Dr. Margolis. He was recently elected, just recently, I believe this morning, we got the news for the National Academy of Medicine. This is an incredibly prestigious honor, and it's such a privilege to be able to, work with Dr. Margolis through Improve Care Now. Dr. Margolis is the co-director of the James Anderson for Healthcare Systems at Cincinnati Children's. He's the executive scientific director with Improve Care Now. And again, the parent working group just wanted to congratulate Dr. Margolis on this very incredible achievement. So very, very excited for that. Next slide, please. And then our final announcement is that the parent working group leadership is experiencing a transition. We wanted to thank my co-lead, Deborah Ostegi, who is coming to the end of her tenure as the parent co-lead for the parent working group. And if you've ever met Deb, you probably haven't met a friendlier, warm person. Her incredible leadership, dedication, and loyalty to Improve Care Now has been exemplary, and it's with heartfelt thanks that we wish Deb well as she transitions out of this role. She has agreed to stay on as a mentor to the parent working group after the completion of her tenure. But we did want to acknowledge and thank Deb for all of her hard work and dedication to Improve Care Now. Next slide, please. So right now, the parent working group is in a period of transition. We have to think about things a new way of thinking. Historically, we've had, have enjoyed many parents being able to attend the national conferences. And during those times, it's an incredible opportunity to network and learn from one another and really work off that synergy and energy that happens at those community conferences. Because we've had the funding, we used to be funded through CCF, and they had opted to, they had offered that funding for a period of time, and unfortunately that funding has ended. And as a result of that, there's been a gap in really being able to provide resources to get as many parents as we used to have to the conferences. With that in mind, the parent working group has to think differently and adapt to the changing environment. These are the realities that fewer parents are able to attend the community conferences. So we really need to think about how do we support one another? How do we continue with this mentoring? How do we have a vehicle for the voice virtually? And so these are the new challenges associated with the parent working group, but we're excited by the opportunities. I think one of the things that makes us feel a little bit happier is that when Chris was looking at the data, people feel very comfortable in this format in terms of being able to communicate via online. So we need to be innovative in our thinking so that we don't lose that momentum and that synergy and sense of support that we've had in the past. So in terms of victories, the parent working group is comprised of incredibly talented and dedicated caregivers. And I think you just heard an example of that with the folks from Children's Mercy, that there's some incredibly innovative, groundbreaking work that's being done throughout the country and in fact, internationally, with parents as stakeholders being involved in this process. And we'd like to help enhance and continue that throughout our tenure here. So at our fall community conference, we had about 18 parents from across the country. We engaged in really innovative and interesting discussions. We had lots of sharing of ideas, and we did an exercise with the following kind of questions. Who or what is your why? What are your care center's goals? What are the exciting things that are happening at your care center? What are 2 things that you want to learn and 2 things that you want to teach? So you can forward, Chris. Another one. Okay. So when we asked the question, who or what was your why were they at the conference? These were some of the answers: to improve care for our children, to share seamlessly and steal shamelessly, to increase engagement at the local level, to impact change without reinventing the wheel, to grow personally, to present at the conference, and finally, a physician invited them. Next slide. What are your care center's goals? This was actually a really interesting question because 50% of the folks who were there weren't really sure what the care center goals were. And we see that as a gap and an opportunity to really engage in those local centers to be really an integrated part of that team. So it really presented an opportunity moving forward from the conference to really engage with your local centers to figure out what it is that they're trying to achieve. Some folks talked about the improved remission rates, again, looking at QI, increased parent and patient involvement, establish parent support group, develop educational events, learn to help the center develop goals for a parent group, a transition booklet, and getting ideas for improving communication with centers locally. So those were some of the local goals that they had. Next slide, please. So what's happening at your center? And I found this to be the most striking part of it. There's some incredible work that's being done throughout all of our local centers. And, you know, wherever you are in that process, really focus on those little victories. So some of the things that are happening at other centers are participating in the QI process, strategy and population management meetings, meet monthly or quarterly, having parent meetings, regular social events for families, educational events, fundraisers, increasing engagement in the community involvement, mentoring programs, art therapy for patients during parent meetings, moving IBD clinics off campus due to California insurance rules about infusions, grant-funded programs, phone apps, web-based tools, IBD handbook and revisions. Again, this is really innovative work that's being done, and I think it was really nice to be part of the community and be able to hear all of the excitement of what's being done and what could possibly be done in terms of opportunities at local centers. Next slide, please. So 2 things you want to learn: everything, how to increase engagement, how to start a learning network, how others support transition from peds to adults, how other centers manage infusions, especially, you know, at home versus at clinics, how to support and involve siblings. And then finally, next slide, please. 2 things that I can teach: how to onboard parents and patients, how to have a voice, how to spread word about the care center, and how to start a support group. So there was lots of opportunities for sharing. Next slide, please. So I think the takeaway is that Rome was not built in a day, that your efforts will bear fruit. And the other big takeaway was put the oxygen mask on yourself first. It allows you to care for others, and you have to care for your own emotional and physical self before you can take care of others. And I think as parents, oftentimes we put our needs behind our children's. I think the biggest takeaway from the community conference is that we have some wonderful opportunities for the future. One of the things that we identified is the ICN website. It's hard to navigate and not particularly user-friendly. One of our goals for the future is to be able to harness the energy and the collective creativity of our parent working group in a way that is meaningful and easy for others to access. The other thing that we were thinking about is creating toolkits that can be used throughout the network. And those are opportunities for allowing other parents to be able to take what people have learned and then implement it in their local centers. So opportunities and themes for improvement. One of the things that, because we're working virtually, we wanted to be able to develop these relationships among other centers. So developing a list of parent experts, coaches to help other care centers. We want to be able to create our own resource network within the parent working group that other centers can go to. So say, for example, you were interested in perhaps starting a communication tool. Well, then maybe you would reach out to Mercy Hospital, Mercy's Children's Mercy, just to be able to get that information. Being able to create this network in a usable, friendly way to allow us to be coaches for one another is one of our bigger goals. We did a voting exercise just to figure out, what are the topic areas that people felt particularly strong about. And you'll see down below, the numbers of votes. The top one was how to put on educational events, onboarding new parents to advisory teams. The other things mentioned were fundraising, social gatherings, IBD handbooks, toolkits, etc. These are opportunities that we have experts within the parent working group, and we want to harness that energy and harness that collective knowledge so that we can use it in very practical ways. And so as one of the goals for the future of the parent working group is to be able to, again, kind of collaborate that information in a usable way that other people can really benefit from. So across the miles, next slide, please. Across the miles, it's the shared sense of purpose, it's the dedication and friendships of the parent working group that will really allow us to grow and be successful. These are just some samples of pictures from different community conferences, but it's folks coming from all over, all areas of the country, bringing their passion and the expertise to the parent working group, really for the common purpose of improving care for our kids. Our shared purpose is really to improve care, and I think, this represents really the essence of what we're trying to accomplish. When we talk about who our why is, there was an inspirational talk by Isaac Sharanga when he talks about who's your why. This really, I think, encapsulates what it is that we're trying to do. Who motivates you to do what you do? When you look around and look at the people in your life, who can you say, because of you, I will do more, be more, and become more? The parent working group is inspired by not only our patients, we're inspired by each other, because this is a tough road none of us chose. But if we can take our collective energy and our enthusiasm, there's incredible things that can happen as a result of that. And I think Chris is taking over the next part. So thank you.